Well, I hope that transition went smoothly. So, Lily T, thank you for being here. You're first in the house today. Thank you so much for coming. And Priscilla, glad you're here. We should be seeing BFF Lisa today is going to be sharing with us. We're going to be talking to a couple different people about their experiences with chronic pain. One is my BFF and one is an older sister. Now, if they're just able to find their way here, that's all I'm worried about. Hi, Lynn Nioki. So happy to see you. Glad you are here. Third? Yes, ma'am, third. But you know what? You made it, and that's really all that matters to me. I kind of want to double check on these. These two people. One is fairly, you know what? Some of us are just a little bit challenged with this tech stuff. I say, click the link, and I get a blank stare. Looking back at me like, what do you mean, Lucretia? Click the link. Where do I go from there? Okay, I'm going to let her know that I'm started. All right, so in the meantime, I'm just going to get started chatting away, sharing some information. So I've done a lot of research on this. Take a stab, Priscilla. The one with the most experience, well, I shouldn't even say the most experience with chronic pain, because I know that Nancy has a set of her own chronic pain. Thank you, Lynn. I appreciate that very much. Yesterday, I looked like I just crawled out of bed, because guess what? I did. I just crawled out of bed. No, I was out of bed for a few minutes. And my friend, I believe that's BFF right there, and she did make her way here. And so, yeah, Priscilla, we'll see if the other one shows up. So what I'm going to do is I'm going to jump right into this, because there is a lot of information here. And actually, I had someone who asked me in a message just a little while ago, what good does... Hello, Kaylee. Thank you for making it. I'm sure there's a lot going on. I know there's a lot going on right now. I started a few minutes early. You know who taught me to do that? Oh gosh. She and her husband have not really been active in YouTube in about a year or more. Teresa from, gosh, I can't think of her channel name. Sweet lady. Her and both of her and her husband retired, bought a beautiful RV, fifth wheel, of course, and took off. I think they're from the Midwest or the South or something. And so, anyways, there's actually, Lynn, there's 6 of us. Unfortunately, we lost a sister 23 or 24 years ago. One of our older sisters, Annette, who both Priscilla and I were very close to. And she had multiple brain aneurysms that were the culprit. And maybe her friend Frank could find her. Just thought. He's in the field. And then our oldest sister, Linda, she passed 7 years ago yesterday from COPD. And Linda was very connected to us. Truthfully, even though she was old enough to be a mom, a young mom, but still old enough to kind of be a mom to us, we were best friends with her. Linda and Priscilla and I were very close. And actually there's closeness amongst all of us, but there's sometimes special different closeness. So I had a question about what would physical therapy do. Oh, thank you so much, Kaylee. Super simple. Thank you, Peggy Watkins, for not being here, but thank you for cutting my hair. And she does an awesome job. She used to be licensed, but she doesn't like the work. And she's an artist. I really see her as an artist. She knocks it out of the park for me every time. If I remember to, I'll show you the picture on here of where we started at as far as what my vision was. So I was asked about, does physical therapy do anything for arthritis? So let me share the screen here for una momente, and let's share that. So, and this is from the Mayo Clinic. Easing arthritis, exercise helps ease arthritis, pain, and stiffness. Here's what it does. Why exercise is needed. The right kinds of exercise can improve health and fitness without hurting joints. So let me tell you before I go on, and I've had a physical therapist for the better part of 10 years. Many times, the same one. I love Carla. She knows my case, so I always felt safe with her. When we would get to a point of pain, there's a certain pain, it's just not meant to be. Okay, so pain is not necessarily gain. Pain can actually be a setback, and it's the job of the therapist to make sure that you understand that. I'm not saying I always did what I was supposed to do, and I still sometimes have that old thinking, the thinking that in part got me here. Pain, without pain, there's no gain. Story I was told back in the late 70s from trainers who were also, driver's ed teachers and whatnot. So anyways, all right. So what it can do, and strengthen muscles and joints, help maintain bone strength, increase energy, make it easier to sleep well, help control weight, improve balance, and improve mood. Because those endorphins that are the feel good brain chemicals. Yay, endorphins. So our bones need strong muscles for support. Not exercising weakens those supporting muscles. Weak muscles put more stress on joints. Anyways, and it's also recommended to check with your healthcare provider, which I am not a healthcare provider. I'm a human being who has had a lot of spinal problems. To check with your healthcare provider before you start any exercise program. All right. So I got that information for someone, and she may be listening. She had to go drive somewhere. So if you are listening, see, there are some good reasons right there. Strengthen muscles and joints, help maintain bone strength, increase energy, make it easier to sleep, help control weight, improve balance, and improve mood. I now take a medication to increase bone strength. It's a sad day, but yes, I do. I take medication to increase bone strength, but I do it. And by the way, read the instructions on that stuff, because I had not read the instructions. It's a pill. I take pills. I have medication I take, and about a year ago or so, I took all my medications, including that one, and then I laid down. Well, I did not know is that medication you are not supposed to lay down with. It's Fosamax. because it can swell. It could swell up. And guess what happened? It burned my throat very badly. It swelled up. It burned my throat. I thought I wasn't going to be able to breathe. I called my son out here, and Richard, I'm dying. Please get 911. And so, anyways, as we were talking to the emergency room doctor, we kind of figured, as I was talking about my day, because they want to know when you can't breathe, what has happened, and so we went through my morning, because there was burning and burned throat. And so we talked about it, and then they explained to me. But no doctor ever told me don't lay down after you take Fosamax. So, anywho, there you go. That's for Robin. Let's see if there's anybody else here. Me and my older sister just, oh yeah, we have, there's 13 or 15 years between Priscilla and our oldest sister, Linda, and 13 between me and Linda. Oh, physical therapy may increase range of motion. I was able to get around my house again, avoided narcotic painkillers, hospital, and surgery. And as long as you can do that, absolutely. Oh, please, yes. Put it off as long as you possibly can. 6 weeks of therapy. Well, that has to, in most cases, has to do with the insurance, and improves flexibility. Lisa and I have been in physical therapy together at the same time with the same physical therapist. All right. So, all right, Lisa, what I'm going to do, docs have failed to give me instruction before also, although not skipping insulin wasn't one of them. So, okay. Yes, ma'am. You go do that, please. 16 years between you and Linda. Wow. So 14 between Linda and I, 16 between you and Linda. All right. So I'm going to bring up my first guest today. All right, Lisa, what I'm going to do is, I'm going to drop a link for you. It's only for Lisa, please. And I'm going to put it here in the chat. You'll see it come up. And here's what it is. So, Lisa, all you have to do is click on this link right here. It says who I am and StreamYard, blah, blah, blah. So you click on that, Lisa, and it'll take you into my basement. And then once you get there, I will bring you up. In the meantime, I'm going to share some more information that I have. So, wow. Chronic pain. Here are some of the chronic pain. Whoa, I hear Lisa right now. And I think I'm going to stop with that because I'm going to focus on my guest. All right. If you're ready, Lisa, just wave at me. She's shy. She's just a shy little girl.
Hi, everybody.
Hi. This is my BFF, Lisa.
Hi, everyone. Hi, Elle.
Hi, sweetheart. How are you today?
In pain, but I'm okay. I'm doing this for you.
I know you are. And I hope there's something you get out of it too, because you and I both know sharing our story a little bit can be useful. If not for us, for somebody else.
Hope so.
So, do you want to share a little bit about, or do you want to share when your pain story began?
Okay. So, and I was thinking about this earlier today. My pain story started in 2021. I was coming home from work and I had a catastrophic car wreck. and I was a passenger in a car, and we were hit at approximately 55 miles an hour by a man in an old Dodge Ram pickup with a full-size camper on it. We were in a little Chevy Beretta. Right before impact, the tires were squealing so loud that I knew immediately that we were going to be impacted in some fashion, and I immediately seized up. Within seconds, he hit us so hard that we hit 5 other cars. Ricocheted, came back and hit him and flew forward again. So I hit the windshield 2 times, came back, and when we had finally stopped, I was staring at the headliner of the car, and I'd been knocked out for a few seconds because my girlfriend was screaming and I was telling her to shut up because it was scaring me. Then I flashed on a car wreck that I had seen years ago where a person was literally encased in flames, and I told my girlfriend to get out of the car because I was afraid we were going to be soon in the same predicament. And so I got out of the car, and I was so dizzy I just had to lay my head on top of the hood, and I couldn't stand to go anywhere else. Thus began the story of my pain. I immediately started to stiffen up really bad. Went to the emergency room. They said that that was normal and just go home and rest. I stiffened more and more each day. And I had no idea what I was in for. My job kept my position open for me for 3 months, which time I began physical therapy, which at that time the physical therapist was so much taller and weighed so much more than me, and he just really hurt me more and more by the way he would twist and pull on me, and it just made things a lot worse. That time my doctor diagnosed me with fibromyalgia, and my low back was hurting me, my neck was hurting me, and again I just kept getting stiffer and stiffer. As the years went by, I became like a sheet of steel from the base of my neck to the heels, the back of my heels. I've ended up with 15 different medical conditions as a result of not being able to move my body like a normal person does. Some of them very serious as a result. And I've had very crappy medical care because I'm poor. And in my opinion, the medical community has failed me in many, many ways. Lucretia
Can I ask
can
you a
attest to
question?
that. Yes,
Yes,
ma'am.
I can. So going back to when you had the accident, what kind of imaging did they do to figure out your damages?
They didn't really do anything. They gave me some x-rays at the chiropractor. I can't even tell you when they finally did the first MRI. But that's all I really remember happening was getting those x-rays when I went to see the chiropractor. And I don't remember anything else, to tell you the truth.
So the night or day of the accident, nobody intervened and put you in a CT scan or an MRI or
I
x-rays?
was just seen at the emergency room, and they just told me to go home and go rest.
That's frightening.
It was. And I didn't know what else to do. I was in a state of shock. I mean, that kind of an impact. I mean, I just kept reliving that whole thing. It was just, even now, I've never gotten over it. The PTSD behind it has been, and all of the fallout from it has been, it's dictated my life. I was 40 years old, so capable. I was running my own kitchen treatment center.
Lisa, we can't hear you. Your hand is over the
I'm
mic.
sorry.
It's all right.
I was 40 years old. I was so capable. I was running a women's and children's recovery house. My job was running my own kitchen in a men's recovery house. And all of that was taken away from me from that wreck. And I, here I am, 62, almost 63 years old, and it has robbed me of a life that could have been so, so different. And I mourn my health almost daily, let alone the pain that it's caused.
You just made a powerful statement that I've talked about with my sister. I may have mentioned it on here, but and you and I've talked about this, mourning, how you mourn your health. Because you were, at one moment you were a healthy, vibrant, thriving woman, and the next moment you were injured, and from there forward the medical community dropped the ball completely. And I have been with you in doctor's appointments, so I'm well aware of how, although we've had similar insurance, I have not had necessarily the same bad experience you've had, and you've had some bad experiences, but definitely you have suffered.
Yeah.
So what have they offered? What's been the options for you?
Well, I at one point I did do acupuncture, which didn't work at all for me. I have done physical therapy. That has been a blessing. The few times I've done that,
Mm-hmm.
um, that has been very helpful. Um, I love doing water exercises because it's the one time that I can feel weightless and I don't have to feel the heaviness of my pain, and I can just actually relax. And I get a lot of enjoyment from that. Um, what's something else? I've been given in the past a TENS machine, and that was years ago. And I actually was just given one yesterday by my insurance company. So I'm grateful for that. Those do help a lot. I'm looking
Yes.
forward to using that. um, Medicine, I do have some medicine that's, um, I'm on a pain contract for that. And I'm
Mm-hmm.
only given a very minimal amount of narcotics. And I'm watched closely for that so that there isn't any concerns about, um, overtaking the medicines or anything like that, because
Sure.
narcotics are so, they're not good.
Right.
And those I only take on a rare occasion when I can't stand the pain anymore. Um,
So the only time you really have felt relief is a little bit of physical therapy, and in when you're doing water work
or,
within in the pool
or taking some pain
or pain.
medication as a
Okay.
last resort. Yeah.
So what do you think is the problem? Do you have an instinct for what might be wrong?
I just think that I have disc degeneration in my cervical area besides my disc degeneration in my low back. And I just
Mm-hmm.
think everything's all screwed up there. Not to mention that now I need a knee replacement, and the other one's getting just as messed up. I mean, I need some medical attention, and it all needs to be addressed. It's instead of just you know. And I get sent to the same doctor who she gives me these nerve conduction tests, but that's it. She's, in my opinion, rinky dink. And I need more attention than what I'm getting.
Right. You really need, you need it. You're one of those people who does need an MRI head to toe, your entire spinal cord. And then to go from at least to know what's really wrong now after all these years of not really getting attention to it. And
Well, and arthritis, excuse me for interrupting, but arthritis is set in almost all my joints now, too, you know. And so that's made it really difficult, too, because there's not much you can do for that except just moan, you know.
moan.
I mean,
Well,
really, that's
yeah.
all you can do because I mean that's down in your bones. You know, it's osteoarthritis. So, I mean, really,
Well, osteoarthritis is different than, okay, so the osteoarthritis is, okay, the bone arthritis. Well, so
yes,
there is, so as I was reading, one of the things that I shared and I read was about continuing to move, keeping our
yes.
bodies moving to the best of our ability, which, by the way, when you need knee replacements, is a very hard thing to do.
And you know my story. I mean, my back, because it's like it is and has deteriorated like it is, I can only stand for less than a minute, let alone bend over or anything, let
Right.
alone walk like that. So I'm just in a catch 22. It's and you know, I just had major surgery on my stomach, which I need to be walking. I need to be able to exercise, and the only relief I'm going to get is to be able to get into the pool. But because of my knee being like it, I'm just kind of in a not so good place right now. But you know what, I'm not giving up. I'm not giving up. I've come this far. One of the reasons why I had the surgery I just did is because I've been robbed of the opportunity to be able to enjoy my grandkids. And I'm only 62. I want to live the rest of my life having the best life I possibly can. And by golly, I will. With God's help, I will.
Absolutely. But you had stomach surgery?
Yes, ma'am.
Did you want to share what that stomach surgery is, or?
Not really.
Okay,
I
that's
mean,
fine.
I will if you think it's beneficial,
Wait,
but
you mentioned it, and we were talking about one of the ways is how people, different things people do to try and improve their health.
well, then, okay. In the middle of June, June 14th, I had bariatric surgery because one of the things, medical conditions that I unfortunately ended up with is Hashimoto's, which means that my thyroid doesn't produce any hormones like it should. I've been on 2 thyroid medications for the last few years, and I gained massive amounts of weight, let
From the
alone,
Hashimoto's.
yes, let alone poor eating habits, and again, inability to move my body. When you live a sedentary lifestyle like I have for the last 22 years, you're not gonna you're gonna put on weight.
Mm-hmm.
And so I was to the point where I was literally bent over looking at the floor to try to stand up. I could barely stand up. I could hardly walk to get out the front door to my mailbox or to my car or anything. And the quality of my life was, not to mention having COPD, just all these things. And so this had to be a choice between life and death for me, in my opinion, because I didn't think I'd be here much longer if I didn't make this radical change in my health. And so I chose to have this surgery.
Well, and you also just mentioned something else. Okay, your COPD. You made another radical choice. How many years ago?
It's been 8 years. I gave up cigarettes after 46 years.
46. And She used to smoke those really what were the cigarettes you smoked that were really big?
Marlboro 100s.
But there's another one. Remember, they were
I smoked American Spirits.
American Spirits. These cigarettes are like monsters, and
they're
for
not that big. They're just.
But the fact that she loved to smoke. Am I correct?
I did.
Yep. And the fact that she was able to do it, recognize what it was doing to her, and there was her one of those first steps in claiming her health back. You know, is dealing with that. So I commend you greatly for that, because it killed my mother and it killed my oldest sister, and so I understand the damage very well.
My gift was learning I had COPD, but you know what? That's one of the consequences when you choose to smoke. That's,
sure.
You know, I mean, that's just the way it is. And I mean, at least it's only moderate. It could be a lot worse. And I'll tell you what, every time I'm huffing and puffing and I can't catch my breath, I remember the reason why. And I can't stand cigarettes now. They make me sick. I can't stand the smell of them. I can't. Every time someone smokes around me and I get the scent of them coming by and I start to choke on them,
It literally physically affects you now, because
yes.
All right, so I know that is not about shaming anybody else. It's just about that was for you one of the first steps you made in your health recovery.
Yeah.
All right. Do you have any plans going forward that to deal with this chronic pain? Well, so just one question first. So some of the small things you do that help you. Is there anything that you do besides? So you do occasionally have to take pain medicine. What else do you do that gives you any relief?
Well, now that I've been cleared to get back into the pool, I'll be getting back into the pool for a routine.
Yep.
On a regular basis. Obviously, I'm a heck of a lot more mindful of what I can eat and not eat, and I'm choosing that because, I didn't go through this drastic surgery just to undo all of that. I don't know, I can't really think of. I'm just taking it one day at a time. It's step by step for me
Sure.
now at this point. And
Sure.
I'm just trying to figure it out as I go along.
It is. Does it sometimes I know, since I know you, I know it seems like a long road. It's been a long road.
It has.
But you're also scheduled to get checked out for your knees?
Yes, in September.
Uh-huh.
And that'll have to be a ways down the road because,
right.
Taking a month off from work for this recuperating from the surgery's been it's been financially not good.
I understand. I hear you, Lisa. All right. Well, your fans are clean and waiting here at the house.
Thank you.
As a matter of fact, last night after Richard spent, a significant amount of time cleaning your fans, I said, "Hey, honey, I got a fan over here by the bed that needs cleaned."
That's what he said. He said he was cleaning on yours.
It was bad. It was bad.
Yeah.
And ours is a little different, and there's these little intricate things in it. Yeah, he wasn't happy. He'll probably, I don't know if he's going to blame you or not, but if he does, send him to me. All right. So I'm going to drop you down. I've got another person here who's going to share her story as well. But I do appreciate, I know this is not easy for you, like you've never talked in public before. Yeah, but you. I appreciate you sharing this information, and hopefully something helped. And after I'm in between you and my next guest, I'm going to share a little bit of information that I've received on when I was studying about this.
Thank you. I love you, Elle.
Love you too.
Bye-bye.
Bye-bye. Oh, no. All right. So, yes, thank you, Lisa, so much for sharing. It's not easy, you know, when we're in pain and it just never leaves us. It's hard. Everybody who deals with pain knows, knows it's hard. It's very hard to deal with. And my son-in-law threw his hip out and he can't get out of bed now. Uh-oh.
And he needs this walker.
Yeah, take the walker, and thank God we have like a whole plethora of walkers around here. Okay, so get in the pool, yes. Yes, yeah, I'm absolutely willing to get in the pool, and I will be getting in the pool because I really, I'm a water baby. My father taught me to swim when I was very little. Well, I don't know if throwing you in I don't know if taking you out to his waist deep water when you're 5 and having him put you in and say swim is the same thing as teaching you to swim. But I swam, and I've been swimming ever since. All right, a couple pieces of information I'm going to share, and then I've got another guest going to be coming up here. Chronic pain. Okay, so, and I've used really good resources on all of this. This is the Cleveland Clinic. Very, very good resource. So just an overview, a quick overview. What's the difference between other pain and chronic pain? Well, chronic pain has to be there for chronic pain differs from other type of pain called acute pain. Acute pain happens when you get hurt. I think we all understand that. And chronic pain continues, lingers on and on after an illness or an injury should be over, logically. And I believe it is, it'll say more about how many months, how many months it needs to be, but I think it's 12 weeks or longer. But here are some of the reasons people end up with chronic pain. Arthritis, obviously, and that can happen at any time. You do not have to be an old person to have some arthritis. Back pain, which is intricate, many reasons. Neck pain. My little sister getting ready to have her second neck surgery, likely. And there's no option. She is now fairly non-functional because there's a disc that is splintered or something in her neck, and it is affecting the nerve root. And there is no physical therapy for this. There is no injection for this. What they have to do is go in and take it out. That's it. And this happened, a similar thing happened many, many years ago, 15 or so years ago. Same area, the cervical spine. Cancer pain, tumors can cause obviously ongoing pain. Headaches, and sometimes, by the way, people don't always know why they have a headache. It may not even be a migraine. Testicular pain. I know of a young man who had testicular pain when he was a boy. Had to go to the urologist because the pain was very severe. They never did figure out what it was, but the urologist, which was a man and is a very forward kind of guy, very athletic and very nice, very open guy, explained that when he was a young man and in college, that I'm saying it, that his testicles in his thighs were so big because he was an athlete that they would mash his testicles and cause pain. So, lasting pain in a scar. Okay. I have had 12, maybe 13 back surgeries, and I do have scar tissue. And that is part of the long-term problems that I'll be dealing with, is the scar tissue underneath of these. Muscle pain, fibromyalgia. I I've never been diagnosed with it, but I know people who have fibromyalgia being very painful. Neurogenic pain from damage to the nerves or other parts of the nervous system. So that is some of the reasons for chronic pain. And then real quickly, some of the pains that can be associated: aching, burning, shooting pain, squeezing like a gripping pain, stiffness, stinging, throbbing. And it does cause very much anxiety, depression. I don't know too many people who have chronic pain that do not have anxiety and depression as part of the package. Fatigue, because guess what? You just get worn out. When you've been in pain for days and days and days and weeks and months, yeah, you get tired. Insomnia and mood swings. All right, so we're going to move on, and I'm going to invite, I've got another guest. Oh, Vicky, honey, I'm going to have to, I've got a guest scheduled to come up. So if there's time at the end, I'll be very happy to have you come up. All right. This link is for Oleta Himmerly. I'm going to drop this link, Oleta, and if you'll see it. Make sure you have your camera on, even if you don't, and all we do is hear your voice. So I need to stop sharing that screen. All right. So Oleta, do you see the link that I dropped? It says Life of Lucretia, and then StreamYard and something else in it. So all you have to do is click on that. And one moment, I need to help out here in my household. So, yep, Oleta, go ahead and grab that link. In the meantime, while I'm waiting for her. So it is, let me go back here. Okay. Back pain, causes of back, some of the causes of specifically of back pain. You know, we've got 4 different parts of our spine. The cervical spine, which this is up by the neck, which was always really a weird word. Because, you know, as being a woman, you know, I just always thought it was in a different location. Thoracic spine is is the middle of the spine, kind of where you shoulder blades and right down to about your waist. Your lumbar spine, which is where I've had all of my surgeries, every one of my back surgeries in that one area. And then the sacrum and coccyx, which is the very lowest part that goes right down kind of between the butt cheeks. And some of the reasons, you know, that people can get back pain specifically, fitness level. Let's say, you know, people who are physically fit are less likely to get a back injury, but it can happen, especially if they're athletic, they're playing, and anybody can be injured. But generally speaking, it's people who are less physically fit. Weight gain. When you have an injury and then you gain weight, absolutely going to cause more problems and more pain in the back. Job-related factors. You know, there's Richard had a job where he had to push the this barrel around, and it weighed close to 1,000 pounds, and he had to push it. He had to get it in a certain particular way and just use his body and manhandle it. And if any of you have not noticed, Richard is pretty short. He's about 5'6". Well, he's not anymore since his spine's collapsed some, but it was definitely, it ended up crushing the end of his shoulder. He had to have it cut, the shoulder blade cut off, whatever this is called, cut off, because he had injured it. Stress level. If you're chronically have poor sleep, depression, anxiety, back pain can be more frequent and more severe. Now, I'm not sure why that is, but I trust what they're saying. Age. Back pain becomes more common with age, particularly after age 45. And here's what I do know. I've had a great neurosurgeon and doctors. I have had a good experience with my medical care. And I was told a long time ago that everybody, by the time they're in their early 40s, are already getting degeneration in their spine. It's a normal process. What's not normal is to get it so bad that you can't walk. And then heredity. Genetics can play a role in some back disorders. So I'm going to go out of this, and then I'm going back over to StreamYard, and I believe I've got my next guest. Just wave your hand, Oleta, if you're ready. Okay.
Hey.
Hello, Oleta.
Hi.
So, hi. So let me
got my lipstick.
You do or don't?
I forgot to put lipstick on.
Oh, well, damn you, Oleta. So this is one of my older sisters, Oleta. She and I have a lot in common in this respect. So, Oleta, do you want to talk about when your chronic pain started and how, as much as you want to share about that?
Yeah, mine started 7 or 8 years ago, and I was not prepared for it, as most people are not. And I ended up with back surgery that I thought would make it all better, of which the neurosurgeons are not magicians, so not everything works out the way you expect. Mine ended up being a condition that is, I had major damage, and so that damage wasn't fixable. Now I have major pain for the rest of my life, they say, and all I can do is manage it and use coping skills to get through. I have those days like everybody else where it takes me a lot of effort to get going and do what I need to do. So yeah, it's been difficult. It's been an ego buster because you know me, Lucretia, I've been pretty independent in my life.
Yes.
Probably more so than mother and father wanted me to be. But yeah, it's been hurtful in that way as well. So I've had to do a lot of digging deep down inside of how to cope, how to get by and say, I'm okay. I will get through this day. Sometimes it's hour by hour.
True. I do. I know. I know your first surgery, she was in such bad condition, and this is really out of the blue. She doesn't have a long history, did not have a long history leading up to this, but she was in such bad condition. My niece had to fly to Wyoming and literally drive her home because she couldn't drive. And Pat Oleta is somebody that drives. She likes to drive. She's like me.
Driving.
We both love driving, and so it was that bad. It was very serious, and then get her home, and shortly after that, she goes to the hospital, and they admit her into the hospital. She can't move. The pain is excruciating, and I stood there at one point after they had given her an MRI, and I listened to the doctor lie to her, and I called him out on it. I'm sorry. He straight lied to her. right to her face, but she could barely speak. The pain. So here's what I know about pain. And I feel passionate about this for people who go through it, because I do. I mean, I watched, she was in as close to agony as I've seen somebody, except one time with my own self where I was in life and death agony, and my doctor knew it and he had to do something very quickly. But she was in agony, and her voice, she was like this. She couldn't speak. You couldn't hear her speak. And I wasn't going to stand there and let that doctor lie to her. And I just said, that is not true. That is not true. So we have to be careful with doctors. Even, like she said, doctors we trust. The reality is when you're doing neurosurgery, it's extremely delicate work. I have damage, unintentional damage. Obviously, no doctor wants to damage their patients. It looks bad on their resumes. And it just not a good thing. So you've had your first surgery, which was more of a minor surgery. And then
Right. And Dr. Miller went with the less invasive because he, obviously they don't like to, just tear into spines and make those kinds of decisions without trying some of the other ways they know work. Didn't work for me, and we knew that really soon. And this about me, Kay. I don't like to burden doctors with information. I always withhold the truth. And that's been my problem and my challenge. And, to this day, I still feel a little guilty when I have to tell my doctor that I'm having X happen in my life, something that's really a problem and it needs to be looked at. I had a pain in my side and I thought it was probably from my surgery I had 7 years ago, and that it just is the way it is and I had to live with it. But it was actually my hip, and I'm now bone on bone there, and it's very painful. And
Yes.
see, I would have probably just overlooked that because I don't like to bother the doctors, and that's my problem. And I've never ever really gotten over that, to tell you the truth.
Clearly,
No,
you
I
don't want
don't.
to. Do you have any idea why it feels like you're bothering the doctor? I mean,
Because I didn't, I sat and watched Mom in her demise go through so many changes in her medical, and I never wanted to be like that. In fact, I'm on all the heart medicines Mother's on, and I was laughing about it with Donnie the other day, and I said, I have every single heart medicine that Mom was on, and I take them throughout the day at different times, but I didn't think I would ever be on that. So it's ego. It's total ego. I have had to deal with that my whole life, and I don't like to bother people.
well,
You know
you deserve to bother people when it comes to stuff like this, Patty.
Yeah.
Oleta, you deserve
It's
it.
always been that chin up, keep that chin up, move forward, push through, be strong. In fact, when I had the spinal cord stimulator put in and it did not work and I had a lot of pain, and this young lady that was assigned to me from Abbott, which I still intend to write that letter, I was like on my sixth try for the modulation being set. And she told me to just push through the pain. Well, I didn't like that because I had been in pain now for 7 years, and I had this implant put in my spine that was supposed to work. That I had the trial put in, and it worked really good. So I expected that the implant that was permanent would work. And what she did not do is she did not listen to me at all during that experience. And I found since then from another neurosurgeon that the paddles were probably put in wrong. But there again, I try to minimize my complaint factory and not say anything. And I should have probably called out my neurosurgeon.
Sure, Patty, of course.
But
So you've tried. So you just mentioned a lot of stuff, actually.
I had them take that out. So I don't have that in my body anymore.
But what you have, so it sounds to me, what I know that you've tried is you've tried surgery. You've tried. So your second surgery was a fusion, right?
Correct.
Okay, and then you have had physical therapy, of course.
Yes, and then I had the posts and the screws taken out.
Yes. Yeah.
That maybe that's what was causing that pain.
Right.
I do believe
Mhm.
at this point, I'm going to stop you. I do believe my neurosurgeon knew that I had permanent damage, and that permanent damage was probably why I was having the pain.
Mhm.
Neurosurgeons also have a bit of an ego. They don't want to say that their beautiful work didn't work.
Right.
And I know you love him, but I do think that he knew it. He didn't miss the ball. He didn't drop the ball either. He just didn't want that to be my story.
Well, whether they want it to be our story or not, they do owe us to tell us the truth. And I
Yeah.
know you feel like you were not told the truth, and that I never. If that's true, that should not happen. Nobody
Yeah.
should be gaslit.
And communicating is, once I am able to express myself and talk with these doctors, I'm pretty good at communicating. In
Mhm.
fact, I took in my diaries that I was keeping and my charting of everything. I mean, I kept a chart of the pain and when it came and to what level it came. And, on days when I had a good day, I would make notes of, this is a good day, this is what happened, and, I got a good night's sleep or whatever. So my roller coaster of experience here has been to learn on my own a lot of how to cope.
Sure. This is not pain like what you've gone through or what I've gone through is not for weak people who can't tolerate
Yeah.
a really uncomfortable life, because it's been that way for you physically.
Yeah, and before this all started, I had no idea that I had osteoarthritis, even though of the spine, even though it was in my medical records. The doctors never really explained that to me and what the future meant as far as having that. So I think we have to be, as you've always used the term, our own best advocates. And when we
Mhm.
go to the doctor and we see the results of tests, and they may be high or low or in the middle, we need to take note of it and be proactive in our own body care. It's our
Oh,
body.
sure. Anytime I've ever had an MRI or a CT scan, these are usually the tests that we go for this stuff. I always get the results ahead of time, read
Yeah.
them, take notes, and know what that doc. I mean, have some idea about what we're looking at here, because we need to be in that communication. So you mentioned another thing you tried to do to help yourself was the implant. What was that again? What kind of implant was that?
It was a spinal cord stimulator from Abbott Industries, and
Okay.
they do a temporary implant to see if you can tolerate it and if it's something that will work for you.
Mm-hmm.
And I know 2 or 3 people that actually have implants that have had 70 to 80% success with it. When I had my temporary put in, I had about 75 to 85% success in how wonderful it felt, because it took away that much pain.
Mm-hmm.
I don't know what happened with that permanent, but it was explained to me that they put different paddles in, different leads. and they used wire leads in the trial. And then when they did the permanent, it had paddles like a remote control, only they're very, very, very small.
Mhm.
And those can sometimes be placed where they will generate more pain. And that's probably what happened to me.
It just seems like they should have been able to see, done a CT or something and make, see if that was the problem and be able
So
to alter it.
here's what I've learned about neurosurgeons is they say very little, especially if there was someone that they might have some contribution to the pain that they experience.
Mhm.
And this particular experience was not the surgeon that did my original surgery. It was a different surgeon, and he's very good. I mean, he's very good for brain surgery and
Uh-huh.
stuff. But yeah, he wasn't really that delighted in doing something as mundane as putting paddles in somebody's back. But he did the surgery because he makes $15,000 to $30,000 per half hour. And
Wow.
yeah, I saw the bill, but it disheartened me because he then wouldn't do any more for me down the road. He pretty much just shook my hand and said, and there's nothing I can do more. After he took them out, and I of course was very disappointed because I don't give up. I didn't
Right.
want to give up in my quest to know. And I thought, well, surely you are reading journals and writings and the white paper of other scientists and neurosurgeons that are out there doing research
Uh-huh.
and some of the new studies that are coming out. And I went to OHSU and I contacted them. I am on their patient portal now with one or two of the doctors up there. And so, yeah.
Are you going to have you seen somebody at OHSU?
Yeah, I've actually had a video conference call with 3 people.
Good.
And the one neurosurgeon that I spoke to said he would not have done the surgery on my back to start with. So you always get these different opinions by these neurosurgeons.
Sure.
But I did get the surgery, so that's for my rest of my life. And but he did say on behalf of the implant, he said that it was probably placed in the wrong spot in my spine, or it wouldn't have caused so much pain. Again,
But I
I
would think,
documented it in a journal every day, what I woke up with and what I went to bed with. And I had the ability to turn it off so that I didn't have any modulation.
uh-huh.
And yeah,
If it was turned off, did it cause pain?
nope.
Okay.
No, because it was stimulating my nerve pathways.
Uh-huh.
And, I can't tell you about all the different sensations, but
Sure.
it caused a lot of problem.
Is there anything else that you're looking at in order to find a path of relief at all?
Well, after my hip surgery, yes, there is. I'm going to go back into some therapeutics, maybe swimming, and do some moderate kind of exercises.
Mhm.
And through my physical therapy, I think I'll be in really good hands. So I'll start with that and then grow from that. But I'm not going to give up on it. I'd love
Sure.
to do some part-time work. That's my goal.
Right. I know. It's hard when it upends the life of someone so dramatically and traumatically that it has with you. Yeah, for certain. I mean, it's
Yeah. You mentioned grieving and I'm learning a lot about trauma and how trauma can cause the pain to have some magnification.
Mhm.
And my pain is every day. and my pain is anywhere on a scale of 3 to 7 or 8. I don't have the 8 to 10 because I'm not down on the floor rolling around with pain, that kind of pain.
Mm-hmm.
But it is disrupting in my life. And so being able to grieve and understand that this happened to me, I haven't had that opportunity, not at all.
Well,
I
and
don't
it's
cry anymore, as a matter of fact.
oh, well, I do it for both of us then apparently. You know, the grief for me is the grief that I had just finished, you know, my bachelor's degree. I was 50 years old. I had plans. I just got into graduate school. I was a year, you know, I had my first surgery. I think at the beginning of grad school, but it was a minor surgery that he did. It was a decompression, and it was fine. I was fine. I literally went back to school the next week. Okay, it worked well, and then as time progressed and things got worse and things got worse, and I was going to have that first fusion. I was in bad shape by the end of that first graduate year, and I had to leave grad school and did not get to finish. Okay. So, and I had plans. I wasn't just going to school for no good reason. I mean, I wanted to be working in the healthcare policy, helping people get their needs met and get what they need. And I did not spend that time just because I had nothing else to do. Okay. So it upended my life. And also, as the progression, here's another part of this, Patty or Oleta, is the progression of this disease in our spine is such that um, um, it's not going away. So the grief of what's been lost, you know, and what could have very well been very productive, fulfilling lives. And is there a way to do that differently now?
Yeah, they're I guess what the answer to that for me in this time frame of my life is I have to just take care and manage day by day. And like
Yes.
sometimes hour by hour. Today I had to lay down. When you lose sleep, when you have
Mhm.
this kind of chronic pain, it causes the pain scale to go up. And I'm
Sure.
finding that if I don't get a good night's sleep, that I'm suffering the next day. My dog has kept me up until like 3 and 4 in the morning for a couple of nights. And
Is she hearing cougar? Because I know there's cougar and bear in in your backyard.
no, she has to go to the bathroom. And so I get up with her and she goes to the bathroom, and I've got her trained to come right back in the house. And she doesn't want to stay outside. I think she kind of knows that there might be something out there at that hour of the morning. But um, I got her to come back in. It's me. I'm having a hard time getting back to sleep because I
Sure.
hurt.
Oh yeah.
And
Sometimes.
I do have pain management through opioids. So I have to be very careful about what I do and how much I take. And I'm on a contract.
Mhm.
So I take Lyrica, and I also take ibuprofen along with oxycodone. You would think that all of that together in a day would kill the pain.
No, no. I know it doesn't because, you know, I had to utilize some 2 days ago,
Mm-hmm.
and um, at a 6 milligram amount, and it all it does is give me the capacity to not lay there and cry. Okay, so that's just the reality. I don't anticipate my pain medicine when I do use it that is going to make nerve pain go away. There's just
Mm-hmm.
nothing that does. There's nothing that does.
And it just
Priscilla made
changes your choices in life. And I used to be a browser when I went to the grocery store or shopping, and now I even find myself, taking a pass on doing either of those and not
Mhm.
wanting to even go. So that's just kind of a fundamental thing that's changed for me. And, you know, being able to do things for my kids, my children, making a
Right.
nice meal so that we can celebrate a fun time together. It doesn't happen. And so,
Yeah.
yeah.
The other day, when we went to the lake for the 4th of July, when we were not far out across there. We were,
I
you
could
know,
not have done that day. The heat really bothers it.
yes, I understand it. You know, really, when I was walking back, I
With
got,
your sunburn?
well, it really wasn't that bad of a sunburn, but when I was walking back, I felt I couldn't literally take another step because of the weakness in my legs. So that's one of the consequences for me, is this weakness that
Yeah.
I just can't stand feeling weak. I can't. It's just everything inside of me. And I had to stop. And I just told Richard, you've got to go get the car because I can't walk any further. I can't go any further.
Yeah. Yeah.
And nerve, you know, the nerve issues that will make you not, in my case at least, where I can't feel my legs. It feels like I can't feel my legs.
Exactly. I have neuropathy.
Mm-hmm.
I have numbing in my feet. So when I walk too long or I stand too long, it's a problem. At night when I do dinner and then I clean up after dinner,
Mm-hmm.
I try to do as much as I can because it's therapeutic for me.
Sure.
I can tell you I have to go to bed a lot of times right after dinner. So it, because laying down helps relieve the pain. It does. It takes the compression off my spine.
Yeah, that is one of the things. Me too. I'm rarely in bed. I'm rarely not in bed at 7 o'clock. I'm like last night. I was in bed at 5:30. It just had to be in order for me to not have to do pain medicine. I had to be in bed at 4 o'clock. Priscilla has a question here, and Box Van D says she's, praying for you, and all in the chat are dealing with pain.
Thank you.
Thank you very much, Dee. Dee has got a great story of her own. So Priscilla says, so I'm just going to ask, and I don't partake, but could edibles be helpful?
Donnie loved the edibles that Emily brought. And
Mhm.
he has rheumatoid arthritis really bad. He gets infusions every month.
Uh-huh.
And they work really good. I have chosen not to take them because I didn't like how they made me feel.
Mhm.
I wanted to just sleep, and I didn't want to just sleep my life away.
Yeah.
I am sure that they will have some effect, and I'm willing to try that with a medical doctor that would help with the dosing of it.
I think, well, you'll have to go to there must be a medical clinic that,
Well, OHSU, the neurosurgeon there,
uh-huh.
he was not opposed to trying it at all.
Mm-hmm.
And so they're very open to the research side of using
Sure.
them. They're much less invasive than opioids for sure.
Thank you, Dee. There's a particular conversation I'd like to talk with you about, and I'll send you an email about that because I think it would be perfect conversation. So I'll talk to you about that another time. But yeah, thank you
Are you
for
saying that to
stopping in.
me?
Huh?
Are you saying that to me or Dee?
No, Dee. And
Okay.
but Priscilla had a question here. She has a comment. Oleta, I remember taking you to see your PCP and him yanking your legs in all directions. I think he injured you worse.
I don't think he did. I think that he was, how do I say it? He has a really bad bedside manner sometimes.
Is that
And I
Dr. Yang?
just saw him for
Oops.
something else, and he moved my legs around, but much more gently. And because I asked him about that, that time, and I said, do you want to have me as a patient? Maybe you don't want to deal with my kind of pain.
Oh.
And he said, of course I do. And from that time on, he and I got along a lot better. But yeah, when I told him about my hip pain and my knee pain that I have so bad, he moved my legs around. And I thought about Priscilla because she was so upset with how he treated me.
I know.
But no, I don't think he heard anything.
Okay, well, I mean, I remember she was very upset and you were in very much pain.
Yeah. Oh, yeah. Yeah.
It's
Yeah.
just, you never
It's
know.
complex.
Uh-huh.
It's complex. And, you know, if I can give any advice to anybody, I would say, you know, just if you don't agree with the doctor, keep asking questions. If you can get other doctors to do another opinion or to take a look at you, then do that. If you're not comfortable with where you're at with your doctor,
Mhm.
I didn't ask a lot of questions. I went in like the little cheerleader. I wanted to cheer on the doctor so he felt good that day. Bad approach. But a lot of women are like that, Kay.
What not to do. Yes, no, I agree.
A
I
lot of
agree with
women are
you.
like that. We please people. We don't necessarily ask people to give us a little reprieve.
That's true. That's true. I went up to OHSU and I scared the crap out of the girl, and she said they would not touch me with a 10-foot pole simply based on my BMI. So, yeah,
I remember that. Yes.
yeah, that was interesting. All right, well, I won't keep you because I know that you are in pain. I can see you're in pain, and I've got a couple more things I'm going to share with the group overall. But I'm sorry I'm sorry that this has continued to plague you. I had hoped that implant would do well for you. How
I
about a
did
pain?
too.
Have you ever thought of a pain implant?
No.
Has that
I
ever
won't
been
do-
offered?
I
Okay.
won't do that. That means putting drugs inside my body that releases on a timely basis. I'm afraid it would blow up in me. That's my luck. No, I am thinking of asking for a block or whatever they call it, where they give you injections
Uh-huh.
to try and just calm that pain down for a few months at a time. That's what I'm actually going to probably talk about. And you know, there are other doctors that do pain management, and I'm going to maybe look into it and see what's out there.
Sure. I'm going to have to do something different. I mean, there's just no way around it. But anyways, I will drop you down,
Okay.
and thank you so much for showing up. And I'm so
Sure.
sorry you are in pain. I really am. I
Me
hope
too.
something helps both of us someday.
Yeah, I just want to leave you with this. My daughter's birthday was yesterday.
Mhm.
And I cried because on my way there, I hurt so bad. And I couldn't enjoy being with her because I hurt so bad. And, I had to apologize for it. And then, I left. I took her present, and she got a very nice camp stove from me because that's what she wanted. But I hurt so bad, and it changes your day. And like I said, it's hour by hour.
Yeah. Yeah.
Yeah.
And Priscilla says she thinks she missed the class. She doesn't give a crap about pleasing the doctor. No, yes,
know.
that's true. She's
I know.
she's different.
I'll take lessons. Okay, I'll let you go,
All right.
and you have a good afternoon. What's
All
up,
right,
brother?
Patty. Thank
Bye
you
bye.
so much. All right, bye. I have to share since we're talking about bad doctors. So I got Lisa fired from her doctor, from one of her doctors.
Really?
Yes.
Because she asked questions?
So she was asking questions, and the doctor was not being. Patty, all you have to do is hit leave studio. There you go. And so yes, and people, thank you so much for sharing your story, Patty, Oleta. So the doctor was there's no way to explain the rudeness of this man. I can't. All I know is I couldn't tolerate it. You know, I know my place. I was simply sitting there. I was her friend and I was there for moral support. Don't take me to your doctors that are going to be rude to you. No, I just basically said, I cannot believe I've never heard a doctor talk to somebody like this. You cannot even answer her questions, something along those lines. Why are you treating her like this? You know, she deserves to have her questions answered. I mean, I could not do it, you guys. I'm sorry, Lisa, but she didn't like him either. It was a quack. And so yes, we were told to leave, and then she got a "you're fired" letter. I didn't know it was going to get her fired. Certain things, nope, doesn't help. But there's no reason not to ask. The only time I've ever had an injection help me, that is when I don't know if you remember this, but years ago, I was having really bad pain in I think it was my left ankle, the outer ankle. And Dr. Jones, who was my orthopedic doctor, he did some injections into there. And it never really helped. And he said, there's one more level of injection for the ankle. And that's when I learned that the ankle is like either 3 or 5 parts, or the heel ankle area. It's like 3 or 5 sections. It's not just one little thing or one big thing. There's a bunch of things in there. And you have this little fat pad, for lack of it is a little fat pad over that outside ankle area. Hold on. Something went awry there. And anyways, he sent me for guided imaging injection, where they use an x-ray to find the exact point, and then the technician does the injection. And I had 1 or 2 of those gone, never felt it again. So Kaylee says that's why she wears the recorder in her bra. Okay, good job. So a couple more things I'm just going to share in the information that I found. Some ways to treat chronic back pain. Okay, so we've already talked about, so here's, the reasons. Chronic back pain, arthritis of the spine, which, by the way, everybody's going to get degeneration. I've had every doctor tell me it just happens. But most people, there's no symptoms. It's asymptomatic. Spinal stenosis, which is the narrowing of the spine because of whatever's going on in there. And that's in the central canal, and also in this one little area where the nerve root goes through. It can also narrow. And I've had both, so I know. And then herniated discs. And the first herniated disc I ever had, I didn't know what it was, other than I stepped out of bed at 7 o'clock in the morning. I stood up, I stepped out of bed, and the sensation is like the visual that we've all seen when the bomb was dropped on Nagasaki and Hiroshima. Do y'all remember that that explosion? That's exactly visually what I felt on the inside of my middle back, down in my lumbar spine, was that. It's the way I've told my neurosurgeon that. I said, that picture that they show that's historical, blah, blah, blah. He had never had anybody explain it like that, but that's how it felt. And it was a horrifying experience. So, and then this myofascial pain syndrome, unexplained muscle pain and tenderness. All right. So, some of the ways that we've talked about already to treat it. Physical therapy. I've had weeks and months and years of physical therapy. It helps, and then it doesn't help. retraining your posture. So like right now, for instance, I noticed I'm sitting here. If you haven't noticed, my left shoulder is kind of up, and it's because I protect my shoulder because I need a new left shoulder. It's completely bone on bone. And so I catch myself literally, it is winged in, you know what I call wing. I got my wing pulled in, and I have to intentionally drop that shoulder, because what happens is I end up tensing up these muscles so badly that I can't. One time I couldn't move, my left arm wouldn't extend. It wouldn't extend. I've really screwed up my muscles trying to protect my shoulder. So retraining body posture is important. Testing limits of pain tolerance. Trust me, I've done that, and I still do it, and I'll always do it. And I know what my body can tolerate. 2 days ago, I couldn't tolerate anymore, and it was a 10. I was literally standing stuck at my dresser. I didn't know if I could go left or right. The pain was so severe that I was holding on to my dresser, and I was feeling desperation, but I couldn't physically like reach out to grab my phone because the pain was that bad. And so once I forced myself back onto my bed, I took pain medicine. Stretching and flexibility exercises, absolutely. I do those almost every single day, and it's good for whatever it's good for, but it's not going to fix my spine. Aerobic exercises I can't do. I've been suggested not to do, except for water aerobics. And Lisa and I and my little sister are likely going to be doing that together at some point. Core strengthening. And trust me, I have a core, people. It's there. I mean, really, it's there. I could feel it. I used to have an excellent core. I don't anymore. But I do understand the importance of it because it pulls on my back. My abdomen pulls on my back. So, of course, I have some common sense and I understand. Just one moment, please. Just one moment, please. Oh, darn it. Czar. Richard. Oh, Richard. Mindfulness and meditation. So how I've experienced mindfulness, for me, meditation, how it works for me and how it helps me is that when I do meditate, I get myself into a physically relaxed state, an emotionally and mentally relaxed state, and I can let go of, even if there might be some pain, it feels like it's not as intense. I don't know if it's real or not. All I know is that's how I've experienced it. Diet and meditation. That's a Freudian slip. Diet. So I, like many people, have struggled as the pain increased, my diet got worse, because the lack of ability to stand and chop and cut and do many things that I normally would do has become problematic. So I'm working very hard at a very low carb diet. I wish I could do the carnivore diet just enough to finish losing what I need to lose in order to have this big surgery, but I really can't. I just don't have the means to be able to do just the carnivore diet. And by the way, I like vegetables. I don't know how Camper Van Kevin is doing this without vegetables. I love vegetables. I love red peppers, yellow peppers, onions. How do you eat food without onions? I don't know. But diet, common sense, lifestyle modifications. So here's one of the things was kind of touched on. When you have chronic pain, it's important to accept your limitations and adapt. Listen to your body and pace yourself. Yes, and yes. That's kind of what happened to me on the 4th of July. I couldn't take another step. I felt like I couldn't feel my legs, mainly my left one. And I needed to have the car brought to me. It wasn't very far. And by the way, it angers me that the car is 40 feet away. And there was a time in my life where that 40 feet, even if I was in pain, I still would have walked it. What? You don't walk 40 feet, Lucretia? I couldn't walk 40 feet. And so the car was brought to me. Listening to your body, knowing what you can and can't do. Nicotine, it says here, is scientifically known to accentuate pain and delay healing. Richard cannot have a surgery because he cannot quit nicotine. And it's very serious. I mean, Richard could become paralyzed, but it's his paralyzation time, I guess. All I can say, I don't mean to sound cold or indifferent, but I can only beg so many times. I can only reason so many times because he knows what's at risk. And if, I understand if he could just flip a switch and there not be an issue, he would. He would. Injection-based treatments, we've touched on those. Priscilla, well, our dad had an injection that helped him decades ago. I remember going with him, and it helped him. I've had injections years ago, didn't help me at all. Alternative treatments like biofeedback therapy, laser therapy, electrical nerve stimulation, like what Lisa has. So I'm really curious how this works for Lisa. I also had one of those and I loaned it to somebody and they lost it. Billy. Pharmacologic treatments, analgesics, anti-inflammatory drugs. I would not give up my anti-inflammatories for nothing, except for right before surgery because I don't want to kill myself. And you can't be taking them 10 days before surgery. And muscle relaxers. So muscle relaxers, even though they work on the brain and not actually on the muscle, the communication between the brain and the muscle, supposedly doing something. And then there is, of course, opioid medication, which all three of us do use at different levels. And that's just, everybody has to make that decision for themselves. I can tell you for me, it's a very limited, it's a very hard decision. In part, as you guys know, I'm a recovering alcoholic and I don't want to introduce another addiction. And I do understand how easy being addicted to opiates is. So I'm very clear about that. So things to be mindful for that could be indicators you might end up needing some surgery. New or progressive bowel and bladder issues. Weakness in the limbs, absolutely, which Priscilla has. Gait and balance problems. I walk like a duck. And evidence of increased reflexes. It should say, well, my reflexes decreased. I have none in either leg. I have none any longer. So those are signs that you might need to see a neurosurgeon. I do have the information in the down below. And it looks like there's two of you left, probably Priscilla and Kaylee. All right. So Kaylee, I know it's why you wear a recorder in your bra. Good girl. Good girl. Good idea. And being that Oregon just passed its new law about you can record somebody else in a public space where the idea that you would have any privacy doesn't exist. So I don't know if a doctor's office would count for that in Oregon, but good for you in New Jersey. And then we have here, I was diagnosed with spinal stenosis. Not that I don't believe them, but I don't like their business model. I need a different doctor, better testing, better explanation, as if I matter. Truthfully, that's true, Kaylee. They can only know that you have stenosis through an MRI. I mean, I'm assuming you've had an MRI and you've read it. And I'm sorry you have a shitty doctor, because that's not right. And that does not engender, oh, I don't mind if you cut on me feeling. Priscilla, another issue is women have been treated like hypochondriacs in the past. Absolutely. So be why some try to please. Yep. I think that's very true, Priscilla. Lots of, we know, I mean, women, historically speaking, that's an accurate statement. Food can be comforting when nothing else is working. Eat chocolate. Yes, that's true too. Of course, I'm here. Oh, well, thank you, Kaylee. Not in New Jersey either. Tough nuggies. All right. Well, thank you guys for staying with me and listening to that. I hope there was some good information. There is stuff, some more stuff that's in the description box. All of the links are there. And again, I'm so grateful that both Lisa and Oleta, Patricia, were willing to come and share. I've got another person, a young person. She happens to be my niece. I'm going to do an interview with, a one-on-one interview, and do that as a video. And then she will be on a live stream to talk about it. The reason is she has physical condition that she can't be on. I mean, right now, because she throws up a lot. It's just no way around it. It's got a stomach issue happening that she's going to be tested for. So the things you read about possible treatments are eye-popping. I need to get a good doc, good test, and discuss treatments. 110%, Kaylee. Nobody today should be walking around not knowing, first of all, what they got. It's like I've told Lisa. She needs a neck-to-butt MRI. And yes, Lisa, I will come and sit there with you. They won't let me be in there with you, though. I mean, although when she had to have this one test done, a PET scan, she had to get special permission for me to sit with her in the room right by the bed because she's very bad claustrophobia. And so I had to be right there with her. It's
that handle's just pushed through. It's going to fall out. So
okay.
I'll tape around it so it doesn't.
All right. Well, thank you guys for staying, for hanging out. And, you know, there's lots of people that go live, especially on the hour, Priscilla. And likely that's where they went. And yeah, so that's all right. It's how it is. All right. So thank you for being here. And I hope there was some good information. And I know. Well, I know that it's 6 our time. I believe 6 our time. Roy and Becky are going live. There's going to be a 3-way live. Okay. That's not for 20 minutes yet, to help Melnetti living free zip codeless. And that I will go over to that as well. So anyways. Well, good. I'm glad. And there's going to be more, you know, there's going to be more things happen. Trust me, there's new things come out all the time. There's new things. All right. I'm going to go eat something before that happens. And I feel like I could go to sleep right now. I'm feeling tired, but I want to go help out with Melnetti living free zip codeless, get their hours and whatnot. So anyways, all right. I will see you both later. Talk to you later. Stay out of trouble, Priscilla. No. Oh, yes. And by the way, yeah, I did. I told that doctor, you're lying. You're lying. You're lying. I couldn't help it. I could not help it. I was not going to stand there and let that doctor lie to her when he knew she had no physical strength to fight back, to ask a question. And yeah, I just, you know, I couldn't let him get away with it. Unfortunately, you know, they don't expect lay people to know as much about MRIs as some of us know. And so, anyways, all right. Love you guys. Stay out of trouble.